hyperpigmented problem, we can use hydroquinone. If we want to treat skin rejuvenation, we can use either hyaluronic acid, vitamin C, peptides, enzymes, anything which will encourage the extracellular protein synthesis. So you can choose anything you want. You can insert even steroids, you can insert vitamin A, any active substance, either pharmacologic or cosmetic, can be inserted. Regarding some after procedure considerations, so slight burning sensation occurs right after the procedure, and it usually lasts for about 12 hours. Mild erythema and edema, which lasts for about a day or two. This is the only actual real downtime, because the edema is very hard to cover with makeup. But if you do it over the weekend, usually by Sunday, Monday, the erythema and the edema vanishes, and then what is appearing is mild exfoliation, which lasts for about 3 to 5 days. But I'm telling you from a lot of experience, this can easily be covered with makeup. And you saw the CO2 procedure after 3-4 days. This can't be covered with makeup. Side effects are very rare. Herpes exacerbation is rare. You don't need to give a prophylactic treatment, only if we're talking about a patient that suffers on a regular basis from recurrent herpes infection. Hyperpigmentation, real severe post-inflammatory hyperpigmentation, I didn't see it. I didn't have any post-inflammatory hyperpigmentation. In rare cases, you have slight hyperpigmentation that usually resolves over a few weeks doing nothing. There are also some recent publications regarding this procedure. This is a publication which on patients with stretch marks. 18 patients with stretch marks were treated 3 treatments with the legato system, 3 every 3 weeks, and the active substance that was inserted was PRP, platelet-rich plasma. And as you can see, almost 72% of the patients experienced overall improvement with the stretch marks. And as you know, stretch marks is a problem which until today we don't have the ideal solution for it. So we can make it better, we can improve the condition, we can't make it go away. So 72% improvement in 72% of the patients, that's a lot. Another article from Brazil, 8 patients with stria were treated with RF and retinoic acid on the second phase, and as you can see, in all patients there was an improvement of the situation. So this is an effective treatment for the stria. So now I'll show you a little bit of my results. This is a patient with a skin type something like 4, with very, very deep acne scars. Now, just to let you know that when this patient was a little bit younger, she had gone through deep chemical peel, deep phenol peel, and these are the scars which you see after the deep peeling. And this is the result that you get after one treatment. Now, I don't know if you saw patients after deep chemical peels. In some of them, you have very, very severe side effects like scarring, like permanent hyperpigmentation, and I'm not talking about the result that, as you can see here, is not very good. You can see here, this is before and this is after treatment. No post-inflammatory hyperpigmentation, no side effects, but on the other hand, you have great improvement of the acne scars. This is a younger patient. She has a little bit of acne scars and a little bit of pigmentary dyschromia here, and you can see that after 2 treatments, improvement both in the scars and in the pigment situation. This is a case of very, very severe acne scars. This is one of the cases which I'm working at higher powers, higher than 40 watts. You can see that she improved after 5 treatments. Another case of, this is like the usual case of acne scars. You can see again skin type between 3 to 4. You can see that after 3 treatments, the whole appearance of the skin and the scars looks a lot better. This is a young patient with acne scars. She's 18 years old, and after 3 treatments only, you have very good results regarding the acne scars. This is a surgical scar. Look at this area, and look at this area, and look at the situation after 4 treatments. Again, a darker skin type. And this is a scar which was made by CO2 resurfacing by one of my very respectable colleagues in my country. And this is what I did with one legato treatment. Okay? The treatment is also good for skin rejuvenation. You can see the improvement of the wrinkles over the forehead. Neck. Neck area, you know the neck is a problematic area. We don't have a lot to offer our patients until recently because we don't want to be too aggressive at that area because the healing process of the skin is not so good. But on the other hand, usually the face looks very good because we treat the face because everyone wants to treat the face. And as we get old, the neck tells our age because you can see the signs of the age on the neck. So in my country, there is a great demand for neck treatments. And until recently, I didn't have anything to offer them. But this is very safe procedure and very effective procedure for the wrinkles at the neck. Stretch marks. I promised you some results with stretch marks. You can see this is a young girl. She had autoimmune hepatitis. She had stretch marks all over her body. You can see that we achieved very good results in only after 2 treatments. That's quick. Stretch marks on the abdomen. It's not perfect, but you can't ignore the improvement. The improvement is good, especially if you compare it to other possibilities which we have. This is a patient with very dark skin type, around 4 or 5. You can see she is a young patient. She came to me, she was around 20, and she told me she can't wear a bikini to the sea, and now she can. She's very happy, she's very satisfied. And as you can see, no post-inflammatory hyperpigmentation, and this is a dark skin type. Melasma, you can see here, the mustache area, here and here. You can see the improvement after 4 treatments with the legato. In the forehead area, you can see after 1 treatment only. This is a severe case of melasma, skin type 3 and more, very, very dark melasma. You can see the improvement after 3 treatments. Again, melasma is a difficult situation, is a chronic situation. There isn't a perfect solution for melasma, but you can do something. Again, a patient with melasma. Okay, this is a patient she had a severe melasma. It actually exacerbated after some doctor did here an IPL. They tried to treat this stain with IPL, and of course it made it worse because IPL is not the treatment of choice for melasma. So I did 2 legato. It improved, but the improvement was not as good. So then I performed a superficial CO2. I didn't do a very aggressive procedure because it's a darker skin type and I was afraid of post-inflammatory hyperpigmentation. So I did fractional CO2 resurfacing, and here you can see the improvement after 2 legato and 1 CO2 treatment. And this is her other side. Another case of melasma which improved after 2 treatments. With a legato. Okay, this is a young boy, and he had cystic acne. He still has cystic acne. He's been taking everything, okay, and it doesn't go away. And what you see here, he has all over his back. And what you can see that for the atrophic scars, it works very good. For the keloids, this is a keloid, because I treat it also with steroids and it comes back, and I treat it and it comes back. So for keloids, this procedure is not so good in my opinion. But for all other scars, you can get very good improvement. Here you can see this is what he looks like today. Look at this. It almost flattened completely. Look at this. Look at the scar area here. It flattened. And he is very, very satisfied. Look at the hole here. Okay? You have very good improvement. This is an older lady. She came for facial skin rejuvenation. So you can see the improvement after one treatment. Here the wrinkles is less prominent. Here the wrinkles are less prominent. But then I decided to do CO2 with impact technology, and look at the good results. Again, this is a result after one legato treatment, and this is the result after legato and CO2. Okay? The wrinkles here have almost disappeared. The wrinkles here have gone away. The whole skin texture, look at the pores. It looks much better now. Okay, I like to do combinations. So this is a treatment with severe sun damage. I did DISR, which is the harmony. It's an IPL, which it's a new IPL with you work with the harmony, and then I did one legato, and here you can see the improvement. Look at all those stains; they have almost completely gone away. Okay, so in conclusion, the legato helps us to treat very difficult skin condition. It's safe and easy and quick procedure. You can choose if you want to be more thermal or more ablative. The risk for post-inflammatory hyperpigmentation is actually non-existent, and the downtime is very, very minimal. And another advantage that you get results quite quickly. So now I just want to show you a movie which will summarize the whole lecture, and then we'll go over to the demonstration.
This process perforates the skin, creating multiple microscopic pixel channels, each about 100 to 150 microns deep. These pixels ablate the skin, producing intercellular fluids, which then surface from the microchannels. During phase 2, the cosmeceutical molecules are applied, and the impact module generates acoustic ultrasonic pressure, which accelerates the cosmeceutical transepidermal delivery. The acoustic pressure pushes the intercellular fluid from the microchannels and induces the absorption of the vital cosmeceutical molecules into the dermis. The revolutionary legato system is unparalleled in effective treatment of stretch marks, scars, and acne scars, and is an industry leader in skin rejuvenation.
Thank you very much. If you have any questions, I'll be glad to answer. These are all mine.
La pregunta es, anterior al tratamiento, no exactamente en el momento que se va a hacer el láser, sino días antes, meses antes. ¿Hay alguna preparación inicial para ellos? O sea, ¿manda algún producto antes?
Usually you don't need to apply anything before the treatment. Okay, when we are treating melasma, sometimes you can apply hydroquinone before, but usually it's not necessary.
Anestesia tampoco.
Yeah, of course. I use topical anesthetic cream. What is the name of the creams that you use here?
Okay, understand.
Sí, sí.
I use EMLA. It's,
Sí.
It's a 5% lidocaine or something like that. I apply it for about 40 minutes before the procedure, and it works very good.
Y otra pregunta, los últimos pacientes que nos mostró, en ellos, ¿qué les aplicaba? ¿Cuál fue el medicamento que utilizó? para la penetración? Ácido retinoico, plasma.
I don't use plasma because I don't like the procedure of drawing blood and the separation, and it's not a very popular procedure in my country. Usually I use either hydroquinone, retinoic acid, vitamin C, or any other component, cosmetic components for mesotherapy.
Gracias.
Questions, feel free to ask. Okay, this is a young lady with stretch marks on the abdomen. The procedure is the same. First of all, I clean thoroughly the skin. Okay. Sometimes you can do half abdomen and then the other half, but I prefer to do, again, the painful part in the beginning, to finish it, to do the RF on both sides, and then to move to the ultrasound. But you can do half and half. It depends on what is more convenient for you. It's a new tip? Yeah. Okay. Again, I'm choosing the atrophic roller, the atrophic pin. It's the pin with the 6 pins per row. I will start again with 30. And here I want to be a little bit more ablative because stretch marks are more superficial than acne scars. Acne scars are more deep, so I want to get to the deeper dermis. Here I want to be more superficial, so I'll choose the 3. But I can do 2 passes at 2 and then move to 3. Okay. Don't worry. Okay. Are you okay? Stretch the abdomen. You do a few passes like this, and then a few passes like this. And then I move back to the other quadrant. I do a few passes like this, and then a few passes like this. Are you okay? Okay, so as you can see, the patient is very calm. She is not excuse me?
No, just the cold.
The cold. Okay. I did around 3 passes, but I didn't get enough reaction, so I will do 3 more passes. Okay? And then on the other direction, like this. Okay. Now I get good reaction. Also here. Another 2 passes like this. Okay, this is what I want to get. Slight erythema. Can you get that? No, you can't. You can't see very good. Oh, now you can see. Okay, you see the erythema? This is what we want to achieve. And it took about 6-7 passes to achieve this erythema. And now we go to the other part of the stomach. I stretch the skin, because if I don't stretch the skin, I will bump into the skin and it will be more painful and it will take longer time. So I finished all the passes in this direction, and then I move to the other side. You can do either one like this and one like that and one like this and one like that, but then you have to move your hand many times, and it's quite painful because we work with our hands all day. So I prefer to do few passes like this and then change and do like this. Okay, this I don't do a lot of movement with my hand. What is very important is to keep moving all the time. Don't stay in one position, and the touch with the skin is very, very superficial. You don't need to be away from the skin. You have to touch the skin, but very, very gently. Now we go to the other quadrant of the skin, the upper quadrant. So as you can see, the whole procedure is very, very quick. Wait a few minutes. Until the erythema generates, it takes a few minutes, so I wait a little bit and then I look again. Are you okay? You're almost finished. Almost finished. I just 2 more passes here because I want to get confluent erythema. Okay, now go back a little bit. More, but this is, okay, so you can see the erythema. Can you get it? Not too much, not too aggressive. The patient is comfort. The treatment is very, very quick. Okay, so we move again to the second part of the procedure, the impact ultrasound part. Now it's not painful, okay? Not painful at all. Okay, when I'm on the abdomen, I can be a little bit more aggressive with the